Moving on, nurses across this nation and around the world participated in a global day of action. They're demanding better training and equipment to fight the Ebola crisis. The California-based National Nurses United Union says many hospitals in the U.S. lack adequate supplies of hazardous material suits and other necessary equipment to protect healthcare workers. The United States is one of just a handful of countries that has treated Ebola victims. Michelle Mahon is a nurse for 20 years and took part in today's protest. She's also a representative with the National Nurses United and joins us from Cleveland, Ohio. Michelle, welcome to Arise America. Thanks for coming on.
Thanks for having me.
So we know the broad strokes that this day of action has to do with lack of proper equipment primarily to protect nurses as healthcare givers. But what else are you looking to accomplish with this action?
Well, the nation's nurses are calling upon President Obama to issue an executive order for a mandate for uniform national standards of optimal protection that are in place in every single hospital in the United States.
So is that then where you think the nut of the issue is, that there is not enough federal oversight that would induce hospitals to comply? Or is it that it's not uniform enough from state to state, hospital to hospital?
Well, part of the problem is that the CDC guidelines are just that. They're guidelines. They're not a mandate. Hospitals across the country can pick and choose which portions they want to implement and how. And that's exactly what we're seeing. We're seeing a huge variety of all kinds of different protection and training protocols across the country, and that's just not going to work. We know that hospitals, given the choice, are going to choose cost-cutting measures, and what we're seeing is that it fails to protect nurses. So that's why nurses are taking action.
Just a few weeks ago, last month, in fact, the president talked about how essential healthcare workers are on the front lines of dealing with Ebola. Let's listen to what he has to say. We'll talk about it on the back end. Oh, I am sorry. It appears that we can't pull it up here, but let me just give you a little bit of, I won't read all of it, but he said, Michelle, the bottom line is that they're doing all it takes to make sure that medical personnel and healthcare workers from all countries have what they need to get the job done. Of course, he's talking about you guys, healthcare providers. That's the good news. And that he goes on to talk about seeing progress in Liberia and infrastructure being built. And he said that the United States is leading the way in helping Liberia, Guinea, and Sierra Leone. So he has expressed a support for healthcare workers, particularly those who are going to West Africa to deal with it at, if you will, ground zero. Do you have confidence in that support?
Support is wonderful, but we need more than that. We need action. And that's why we're calling for this executive order. We're calling for a mandate. We also are calling for the world to do more to stop this crisis in Liberia. Nurses around the country know that just support is not going to get the job done. We need an executive order. We need a mandate that is going to compel every single hospital in this country to do what they should already be doing, but won't voluntarily do.
Michelle, you do have some critics for this action. There are some hospital officials, administrators who are saying that the timing of this action, the strike that the nurses union is taking, is irresponsible because we're at the beginning of flu season. Others have accused you of taking this action because the nurses union is in contract negotiations with the California Hospital Association. How do you respond to those criticisms?
Well, first of all, these actions are taking place all across the world today. There are over 100,000 nurses taking action today. So it's not about any particular hospital. It's not about any particular event. It's the entire world and the entire country. There are nurses on strike in Washington, D.C. There are nurses taking action in Maine, in New York, in Chicago, everywhere. So, to those people, I would say that they're really trying to deflect and not focus on the real issue, which is that they are not providing nurses with the protection that they need.
Well, I think everybody could agree that healthcare workers are brave and admirable and certainly deserve adequate protection. Michelle Mahon, thank you so much.
Thank you.